The ICU here at the University of Utah's hospital was at 104% capacity on Friday. Doctors say things are improving, but they're pleading with the community to take the steps necessary to prevent continued strain on the state's healthcare facilities.
We're about 94% capacity, which gives us a little bit of breathing room, but not a lot.
Dr. Vinnick says if the upward trend continues, the ICU may not be able to handle the influx of patients.
Currently, we at the University of Utah are able to staff all of our beds, but that may not be the case going forward if disease continues to worsen.
Dr. Todd Vento, medical director of Intermountain Healthcare's Telehealth Infectious Disease Service, says facilities across Utah are experiencing the same scenario.
We're either at capacity, beyond capacity, or approaching capacity in different healthcare systems throughout the entire state.
And with cases of the seasonal flu adding to the stress, Dr. Vento says the outlook is grim unless things begin to change.
We'd hope to say that we're going to hit shore and see sunshine, but instead a flood and a storm are coming ahead of us.
For staff at the University of Utah and Intermountain, the added strain on the ICU means more shifts and more time spent in the hospital.
We have ICU nurses, doctors, respiratory therapists, other workers working overtime, extra shifts.
The increase on the ICU means the University of Utah has had to delay non-time sensitive procedures, so they have the room needed to deal with the extra patients.
There's a point when you can't cut back any further, and then what we have to do is stretch our staff even more than we're currently doing. And that's not good for patient care.
Doctors from both hospitals are pleading with the community to follow health safety protocols to help stop the spread of the virus.
It's when we start not doing those measures and our ICUs start bulging at the seams when we have to take these second and third line measures. And that's the part that we don't want to get to.
Dr. Vento said the biggest thing community members can do right now to help overwhelmed hospitals is to take the virus seriously and to follow the state's health guidelines like social distancing and wearing a mask. In Salt Lake City, Diego Romo, Fox 13 News, Utah.